morning. They always put me just before the lunch to make you hungry. My name is Amir مراد. I'm a plastic and craniofacial consultant from Riyadh, Saudi Arabia. I'm also an assistant professor at Al-Faisal University. Today I'll be talking about Vicross technology with fillers of the face. What we'll do, I will talk about beautification to start with, then introduce you to my technique, and then best practices, and then we'll do a live demo on 2 models. I'm left-handed. I usually inject the lips from the left side. The face, if I injected the first model on the other side, I usually go to the other side. It's very hard to inject from one side all the products. You can't assess the anatomical area very well. I'll swab again. So,
you're usually going around your patient because you're looking from every angle.
Every angle, for sure.
Sometimes even from the back, and you look at the cheeks. It's very important to assess the face while you're injecting,
yes.
not just at the beginning.
Okay. So even after the nurses sterilize the mouth or the lips, I usually do it myself because what she's done, she's perfect, okay, and maybe the technique that her surgeon or dermatologist does is a bit different than mine. So what she did is this, right? So that sterilized the outside of the mouth. It did not sterilize where I will inject in my technique, okay? So I asked her to part her lips a bit, and I also sterilize that mucosal wet and dry section, okay? In the lips, I'm extra cautious again from infection from the intraoral. It's a dirty area. I know that because of my surgeries on the angle of mandible, I go through the mouth, so I'm very, very meticulous with the mouth. Sometimes after each injection on the lip, you need 3 or 5 injections on the lip to spread your product. I would sterilize after each injection. So off camera, we had a discussion about Muna's lips, and as I mentioned, I have 3 techniques. Can I have the marking pen, please? I make it simple for me. You know, maybe dermatologists are more clever than us, plastic surgeons, but for plastic surgery, we try to simplify things for us and for our patients. And it's good for teaching, and it's good for, I think in all aspects. So one area is the contouring of the lip. I find it less common in the Middle East to need contouring. Most of them have good vermilion border, very distinct. They might want to control it with some makeup. So I rarely inject the vermilion border, okay? And the way to do that is, the way I do it, is linear punctures within that vermilion border. Upper and lower lip. I think it's painful. You might want to wait a little bit longer on your amla or topical anesthesia, or you want to inject local in the nerves. So that's one technique. The other technique, which we've agreed on today, is that she has beautiful lips to start with. And if she does have that, and she's not interested in changing the shape of the lip, so I would just augment the whole lip. You have to keep in mind the balance between the upper and lower lip. The lower lip has to be slightly bigger than the upper lip. Her main concern was that the upper lip, when she smiles, almost disappears. So we'll try to treat that with the fillers today. The third technique is what we call in Arabic زم الشفايف. I won't be demonstrating that. That's my top secret, so I won't show you that. Actually, it's not. But you augment the middle of the lip in this area and the lower lip where it's usually naturally augmented. You don't put any products on the lip laterally. If you need to, you might want to inject above and below the red lip, so in the white lip, to camouflage that and make it more narrower on the sides. So imagine she'll have a fuller lip. You'll have a fuller lip in the middle, okay, and narrower on the side. So that's زم الشفايف. But what we'll do today, for the sake of time and patient satisfaction, is we'll just augment the lip in total. Are they numb? مخدرين? Okay. here, I've seen many doctors injecting and using that distractor. How can you control the lip while using the distractor on the lip? I have no clue. I have no clue. You have a nurse, she can use the distractor. You use EMLA, you use all the other modalities to... Okay, sorry. Is it good? Okay? راح احترق. Okay, I start with the upper lip. Is it okay? Are we on? Hello? Too much for a live demo. Hello? Perfect. Okay. So upper lip, sterile. What I do, I pull the lip, I identify that line that I want to inject, and I start injecting laterally, medially. Stay in that layer. Don't go deep. The vessel is behind you. If you want to aspirate, go ahead for safety measures. And I inject while I'm aspirating, and do move the same pressure that you're injecting, you're moving and pulling that syringe out. So that prevents boluses and accumulation of the product in one area. Okay, alcohol swab. That's what I said about alcohol swab. It's always next to me. I'm always wiping the lip. Is it too painful? It's okay? Oh, perfect. Okay, so you can see that augmentation already starting to appear. Minimal product, I've just used 0.1. Okay, again, I go at the end of my needle where I've injected, go all the way medial. They start having a little bit of sensation more medially, and I'm injecting as I'm pulling out. Okay. Again, another 1 cc. I just press on the product a little bit just to make sure there are no accumulation of product on the lips. Okay. And then again, so this is, I think, the simplest, most satisfying technique for patients and doctors. I'm injecting as I'm pulling the needle out. Again, no lumps, just a linear thread. You can feel that thread when you're more lateral. See, pulling this lip and controlling the lip makes it less painful. Aspirate and then inject as you go. Again, less is more in my practice, so I don't inject them a lot. I rarely achieve one needle in one session. Okay, sorry. Last injection site on the upper lip. Again, as I'm going out. So that's for the upper lip. So I've used, if you see this, 1, 2, almost 3. Almost 3 on the upper lip. I'll do the same on the lower lip. The lower lip are less painful. Okay. Aspirate and then inject as you are coming out. Very simple technique. I know there are many techniques out there for the lip, but this I think is good for augmenting the lip in total. So I'm augmenting every structure as much as it needs. I'm not putting products in a special area or subunit more than other areas, because I've agreed with the patient that she has beautiful lips to start with, so just augment everything.
Do you use cannulas for the lips?
No. Perfect. So no lumps. Okay. Excellent. They might have a little bit of a swelling in the site that I've injected initially, and then as you go, you'd see it less. I'd say don't worry about it. The rest will swell in a few minutes. She looks at the mirror. Usually, I don't do any further treatment after this. I save this for her. It's okay to save the product in a fridge under the patient's name and utilize it again for the patient's sake. There are studies that showed no infections doing that. Okay? Usually a month. 1 month. 1 month for the patients only. If it didn't expire as well. There's an expiry date as well. Sorry? GCIA 8 days. Okay. So follow that if there are guidelines from your authority. But I've read a study that kept the product for a year. It's still within expiry date, and no infections happened. This practice somewhere. I think it's either American or Canadian, and they kept it for 1 year with no infections. It's always better to be safe with these products. I think that's it for our demonstration today. If you have any questions about the technique or specifics.
We open the floor for questions. Please ask.
Thank you. هنكمل بعد هذا.